Hi, everyone. Hi, thank you so much for joining us today. It's great to see such a good turnout and a good range of people. So this is our, this is our first event where we're talking really publicly about this new programme of work we're doing, which we are funded by the Health Foundation to look at the socioeconomic determinants of health inequalities in Scotland, with a focus very much on where we can add value, particularly in that socioeconomic determinants part of it. So we are going to take you through our early plans, and this is a really good opportunity for us to sort of test it out a bit with people, hear what you think, see where you can get involved. And we do have some elements that we will be going out to procurement on over the summer, which we will talk about later on. But in the spirit of Engage Week here at Strathclyde, we are very much about trying to help people sort of come together, talk to each other a bit and make connections that you wouldn't otherwise have made. And the same is true for us as well. There's so many people here we may have heard about and known about, but never had a chance to meet and talk to properly. So we are recording the first part of this presentation, so the bit where we'll be speaking. But then after that, there'll be time for Q&A, and we won't record any of that. And then we hope you can stay for a little bit afterwards, there'll be some cake, I think, outside. So, but we won't, we're not here in this room till 5, don't worry. We'll definitely be out before that, and hopefully, yeah, if you can stay, just to have a chat and to find out what everyone else is doing. So I'm just going to briefly talk through one more slide. So this is just to kind of say what we are. We don't have a name yet, so we are still with a very long title and description. But we are very much here in this space about looking at where we can add value and look across sectors and across different policy initiatives, with a sense where we want to build more effective policy and practice in Scotland. And we are a collaboration between the Fraser of Allander Institute at Strathclyde and the Centre for Health Policy at Strathclyde, where we both have very different expertise in talking to different audiences and doing different types of analysis, but we are kind of coming together to do our best to bridge the gap between us and to facilitate that a bit more widely as well. We are funded entirely by the Health Foundation for this project, for which we are very grateful. And the Health Foundation have also appointed Chris Creegan in Scotland to sort of be the director of the programme up here. So it's very much rooted in Scotland, although they do know what we're up to. But that's how they wanted to increase their presence in Scotland through organisations such as our own, by investing in that capacity. So I'm going to hand over to Chris to do a bit of an introduction to that part of it, and also to reflect back on the work that's led us to this point. And then Kat and I will cover a bit of a summary of our plans so far. And then we've got some time to hear from you guys and to maybe have a bit of discussion about some of the elements that we're still trying to settle on. So hope that sounds good. And I will just pass over to Chris.
Thanks very much, Emma. Lovely to see everybody. I know a few faces and people in the room, but by no means most of you, let alone all of you. So it's really good to see you here today, and I hope you find the event interesting and informative. As Emma said, I guess it's really important to stress that we're in the design phase of this process. We're coming towards the end of that phase. So we're in a very kind of prospective phase where it's very much about, we have some questions, we don't necessarily have all the answers. So it's really timely to be having conversations like these about the plans for the unit that doesn't yet have a name. We've got somebody working with us on that at the moment. So I'm Chris Creegan, and as Emma said, I've been asked by the Health Foundation to work as programme director. Sounds very grand, doesn't it, on this programme? Actually, it's a very much a part-time appointment. So I'm working kind of a day and a bit a week, providing that oversight of the programme at large, and really working as a kind of link between Emma and Kat and colleagues who will be doing the bulk of the delivery of the programme, and colleagues at the Health Foundation. So I am, for the purposes of this programme, I guess, although I'm not employed by the Health Foundation, the Health Foundation's person in Scotland. For those of you who don't know me, I was previously Chief Exec at the Scottish Commission for Learning Disability until a few years ago, and now do a variety of different things, of which this is one. I also chair the board of the Social Security Agency in Scotland, is one of the other things I'm currently doing. I won't go through the whole list, but it's just to give you a little bit of a sense of kind of who I am in the world, and have long had an interest in, through my work at SCLD and other areas of work, I've long had an interest in work around health inequalities. I was also for a number of years chair of the Scottish Association for Mental Health, or Scottish Action for Mental Health, as it's now known, since I departed. So that's me, what I want to do is just give a little bit of a background. I don't want to steal Emma and Kat's thunder in terms of unveiling the first public outing of the plans, but I just want to give a little bit of background and a little bit of context to how this came about, and look back on the first phase of work, which was a large-scale research review commissioned again by the Health Foundation, that in a sense was the forerunner to this programme being established. And I know that many of you, I'm sure, will have seen the report produced by the Health Foundation. That was the report of that review, which was a kind of distillation, a summation of 4, if not 5, I think, further reports which were commissioned by the Health Foundation. I have a lot of slides here that full of graphs and all sorts of things that track some of the key findings from the review. I'm not going to go through them laboriously for a couple of reasons. One, I think you're all, I'm sure, keen to hear what Kat and Emma have to say, and then we're keen to hear what you have to say. Two, I'm sure many of you will have seen the reports, and 3, I think you're an audience who knows this stuff, I'm sure. So I'm not going to labour that point, but I do want to give a little bit of a context to what's led to this point. So yeah, the first phase of work commissioned by the Health Foundation in, where are we? It's 2024. So 2021 into 22 was an independent review which is really reviewing progress on tackling health inequalities in Scotland since devolution. So since the establishment of the Scottish Parliament. I think it's really important to say that the focus, as this work will be, the focus was very much on social determinants of health ultimately, and also to say that it was a review of the progress we've made or not in Scotland. It wasn't a review. The Scottish government are obviously a big part of that, but it wasn't an assurance review of what the Scottish government were doing. It was looking at Scotland at large and where Scotland was and is in relation to tackling health inequalities. So there were 4 main components to that review, all commissioned pieces. The first was a pretty mammoth task, which was a review of public health trends over that period in Scotland, led by Anna Pearce and colleagues, and Anna's here, which is great, from the University of Glasgow. The second was a review of trends in socioeconomic determinants of health and health inequalities, which was led by Emma and colleagues at the Fraser of Allander Institute. And then there were 2 further pieces of work that were commissioned. One was to the DFLI partnership, for those of you who know them, Social Research Partnership, who did some work around public understanding of health and health inequalities and wider determinants of health and health inequalities. And then a piece of work led by Adam Lang, who's now at Carnegie, but was then at Nesta, and his colleagues, which was a stakeholder engagement piece looking at the perspectives of stakeholders on Scotland's efforts over the period to tackle health and health inequalities. So that independent review, the 4 component reports, there was a 5th piece of work actually, which smaller scale piece of work which IPPR Scotland did, which was tracking some specific policy areas. But the review, the distilled summation of all of those findings was published in early 2023, launched at the Scottish Parliament in early 2023. I'm just going to, as I say, I'm not going to laboriously go through it, but just refer to some of the key findings so that we all know the context. We have a kind of shared understanding of the context in which the health determination, the Health Foundation determined that it was a wise thing to do, and I think it was and is, to fund this next phase of work. I'll come back to that. So in terms of the kind of headline findings, so as I say, lots of graphs. I'm going to whiz through these slides, but the kind of key findings from the research review: health and living standards having improved over the period and then stagnated. That's a picture I'm sure we're all familiar with. Expectations of longevity have been revised down over the period, life longevity. Critically, the life expectancy deprivation gap has widened. Infant mortality has risen in the most deprived areas. We all know the picture in terms of the very stark rise in drugs deaths in the most deprived areas. And this is just quite a busy slide, which looks at the very wide geographic variation in life expectancy. So some key findings there in terms of public health trends. In terms of socioeconomic trends, a focus on income and a clear finding around people with lower income tending to have worse health. Income equality having risen since the 1980s and remains stubbornly high. Poverty rates gradually rising. Lower employment for younger people, and especially younger men, and we're going to come back to that in terms of the work that we're planning to do. And a persistent and wide education poverty gap. So these are things that you're familiar with, that we know, but very much set the context for, in terms of public health trends and socioeconomic trends, for the work that we're going to be doing over the life of the programme. In terms of public perceptions, I think just briefly to say in terms of the work Mark and his colleagues did at DIFLI, a high level of public concern with health inequalities. We can send these slides out, by the way, if they're helpful to people. It's all in the distilled and report. And a clear recognition, particularly when informed by expert opinion, of the role of wider determinants in health inequalities. Let's whiz through that. Talking to stakeholders, and I'll mention this because it's going to be a key focus of the work going forward. There was a very clear sense of an implementation gap in Scotland in relation to health and health inequalities. Now, I know the term implementation gap is much used, it's contested to a degree, but there was a very clear sense, nevertheless, from stakeholders that there is a gap between expressed policy intent and impact. The extent to which that is about policy and policy formation, the extent to which that is about constraints on implementation and models of implementation, is one of the things that we're going to be seeking to explore through this phase of work. So I won't labour that point. I will move quickly on to conclusions and what does all this mean in terms of the Health Foundation's decision to invest in this next phase of work. So in summary, what we found through that first review, a lack of health improvement in the last decade, little sign of it in the future in terms of determinants of health. Critically, across a range of metrics, people in the most deprived communities, the bottom quintile in particular, getting left behind. Unsurprisingly, against a backdrop of a very challenging fiscal position, risks to public service delivery, arguably, we are not where we want to be as a country in relation to public service reform and to implementing the Christie recommendations, but really importantly, a sense that Scotland, notwithstanding, there are issues about, and I know there are different views and perspectives about these things. There are issues around powers, and about the relationship between devolved government and reserved matters at Westminster. There are issues about powers. There are clearly issues about the fiscal agenda and investment. But notwithstanding those things, Scotland has the power to act. Action is supported by the public, and it needs to act. And that this isn't a problem that can be solved by government alone. So what the Health Foundation decided to do on the back of that review was to invest in a further phase of work, a 3-year program of work, to enable the establishment of a new policy and research unit, a grant for which has been awarded to Fraser of Allander Institute and Centre for Health Policy at the University of Strathclyde, to provide an independent and critical voice on policy relating to health and health inequalities in Scotland. Not the independent and critical voice, but an independent and critical voice. This is a busy space. My own view about that is that there's more than enough for everybody to do. So we're very much, I think, particularly at this stage in the in the life of the program, understanding the context in which this work is taking place, the work that's being done by others, and looking for opportunities to collaborate as much as possible. But secondly, a key aim of the program is to work with people involved in policy delivery, really to look very carefully at policy options, policy solutions that can help close that perceived gap between intent and impact. One of the reasons why I was very delighted really to be involved as an advisor through the first phase of work and now to be working as program director on this phase of work is that I think the Health Foundation, which is sometimes described in the press and the media as a London-based charitable health foundation, a London-based think tank, the Health Foundation has been really clear that through both phases of work, and remains clear, and we were in London talking to them yesterday actually, because they've been up in Scotland a lot, so that this work needs to be rooted in and developed in and owned by Scotland and its institutions and communities. So all of the work that was funded through the first phase, those pieces of work that I was talking about through the first phase of the review, were obviously anchored in Scotland, and that's a clear underpinning principle from the Health Foundation. And ultimately, what we're seeking to do is to move through this next phase, building on the evidence review focus of the first phase, into a second phase, which is very much about influencing and driving action on the wider determinants of health. I'm going to stop there, I think, because I think that's enough in terms of context. You can fill in the bits that I've missed, but I think that gives a sense of where we've been and why we're here and what you're going to be doing. Thanks, folks.
Thanks, Chris. And we're really keen to make the most of working with Chris's many years of expertise working in related areas, and great to have that kind of expertise dedicated to this and in Scotland. But as Chris says, he's only doing a day and a half, and we get to do most of it. I didn't introduce myself at the start, I think, so I'm Emma, and this is Kat, and so we're the co-leads for this programme of work. And we do have a team that we're building around us. So Ian is over here. So he is you might be hearing from Ian quite a bit if you sign up to any of our contact lists or anything. So he's supporting the programme from the professional services side. We're bringing in, we've already appointed 2 full-time, one economist and one statistician to work on the programme. Who are very experienced and will do a really good job there. And we're about to go out to recruit for a research fellow to work on the programme as well. And we have, we'll come to later, we do have quite a big budget for partners as well to support some of the work, particularly on the implementation gap. So a really significant programme, bit of a once in a lifetime thing for an organisations like ours to actually have that money and resource and opportunity to shape and do something that we really think we can add value to and will be hugely important. I think you were the next slide to talk a bit about the background.
Yeah, great. Thanks, Emma. Yeah, so I'm Kat. I think I know quite a few of you in the room. I'm based in the Centre for Health Policy at the University of Strathclyde, and my background is very much on trying to understand who influences the policies that impact on health inequalities and how those policies impact on health inequalities. So much more on the qualitative side, grounded in health, and my networks tend to be in the public health community. So we're quite hopeful that Emma and I will be bringing those communities together. I did want to briefly acknowledge that when we put in for this piece of work, I was actually a team of 2 with Ellen Stewart, who's in the audience here. So we were both involved, and so thanks to Ellen for working in that original proposal. Ellen is now at the University of Glasgow, but still collaborating. So a lot of my background, where I've been kind of looking at how the research on health inequalities influences policy or not, and how the kind of advocacy around health inequalities functions, has identified that the kind of fragmentation and silo-based nature across research, policy influencing work, and the way policy teams are organised in government does create a bit of a siloed landscape, where you tend to have people doing health research or advocating for health issues, talking to health teams, and then people focusing more on employment policy, say, talking to different kinds of policy influencers and different policy teams. And a lot of people who work on health inequalities and social determinants of health have identified that as a problem. And we're hoping that that is one aspect where this new unit can help, because we're bringing together these different networks. And it was interesting, so recently we were trying to do a bit of stakeholder mapping, thinking who are the key stakeholders who are active in this space, and we started kind of mapping out the various cross-party groups, NGOs, think tanks, policy organisations, and so on. And it pretty much, in a simplified version, looks like this. Like there's clusters around each of these different policy areas without really strong links between them. We're straight from a public health event this morning, which was filled with lots of public health people talking about social determinants of health, and not so many people who actually their main focus is on employment and economic policy. So part of what we want to do is kind of really help with those links across different areas. So we're aiming to look at some key social determinants of health, and we're thinking we're going to be focusing on, we'll talk in a bit more detail later, but housing is one of the key areas, economy and employment is another key area, but also talking to people who work in the health sector. So bring those different areas of expertise together at the kind of research and knowledge exchange level. We also want to, so Emma's background and Fraser of Allander's particular strengths are often on the quantitative analysis side. My strengths are much more on the qualitative analysis side. When I talk to people working in policy settings, they often talk about how it can be quite problematic if they get some work that's taken a very quantitative lens and kind of seems to be taking them in one direction, and then qualitative lived experience type work comes along and seems to say something a little bit different. So we're aiming to try and integrate those different data types together in this new unit, so that we'll be looking at the similar issues but drawing together the quantitative and qualitative analysis, thinking about how lived experience type data helps us understand what's going on in the more quantitative data, all with a view to trying to achieve cross-cutting policy influence. So we've got 4 key components to the type of work the unit will be doing. So we're going to talk about all of these in a little bit more detail. So one of them will be commentary and analysis. So that's one of Fraser of Allander's strengths already on the economy side, isn't it? So like providing kind of balanced commentary when there's new policy developments, new statistics out, providing a bit of a kind of fairly rapid overview of what those statistics mean. So we're hoping we'll become a kind of key port of call for media interest in social and economic determinants. There's also a strand of work that's focusing on data improvement. So thinking about some of the data gaps, particularly around kind of linking data on the more economic side with data on the health side. And David Jack, who's one of the colleagues that's been appointed, has particular expertise in that area. Then some of the work that I'll be leading the Centre for Health Policy, which I'm going to talk about in a bit more detail, is very much around this implementation gap that Chris was talking about. So there it's going to be much more focused work. So we're going to take just 2 key policy areas of policy goals, and we're going to trace down how those policy goals, the kind of big policy ambitions that the Scottish Government has, how that's actually being implemented at various different levels and experienced in communities. And then, like I was just suggesting in the previous slide, there's a lot of work we feel to be done around engagement and bringing different stakeholders together. And this event itself, we hope, is a good start to that.
Great. So I will talk a bit about the commentary and analysis. So we've been developing these plans over recent weeks and months, but there's still room for more, although maybe my team won't like me saying that because we're already planning quite a lot. But yeah, as Kat said, we do want to be kind of a place where people feel they can go to look for sort of that independent and balanced commentary on new developments that are coming out. But we've also got an eye to kind of doing a bit more in the proactive research space as well on this. So these are the things that we are thinking about doing so far. So it's quite a few different elements to it. And part of what we feel we need to do, especially in the early days, is be quite visible and be doing things and be, once we have a name and a brand, like be somewhere that, you know, that people see. The first area is something we'll talk about, which we're calling Prevention Watch. It's something I'm quite keen on, having worked in Scottish public policy since around the time, not before the Christie Commission, and how prevention has been part of our dialogue in Scottish policy for so long. Yet there has always been the sense that we're not actually doing it, but we're talking about it a lot. But so part of what problem with that, I think, is it can be quite hard to pin down actually what prevention is in the here and now. It's quite easy to say in hindsight, we should have done this, or, you know, if we'd done this 20 years ago, yeah, we'd be in a different place now. But when it's coming to what's happening in the here and now, and sort of being able to understand what the evidence is, I think we do sometimes, it's a bit hard to grasp. So we're going to try and do some commentary on that fairly regularly, just trying to go through new developments, new studies, new evaluations, new statistics, maybe doing a bit of looking back through the archive to actually start to talk about prevention more regularly within this space of socioeconomic determinants, of which most of them have an impact on health outcomes one way or another. But that's where we obviously we want to try and pin that down. So it could be like the recent debates on housing and funding for the housing sector, you know, actually sort of doing a bit more of a deep dive into that, rather than just, oh, it's short-termism to to reduce spending on housing, but actually saying, well, why is that? What are the mechanisms? Why is it important? What kind of impact might reducing spending now have 10, 20 years down the line? So that's one thing you should look out for. We're trialing some of these over the summer as well. So some of them might come out under the Fraser of Allander branding to begin with, just until we get ourselves sorted, just to test the water a bit on what people think. We also want to be a place where you can come to for reactive stats briefing. There's a lot of data that comes out in Scotland on a very regular basis. Anyone that's signed up to ScotStat emails, there's always something almost every day. And actually keeping abreast of those and knowing what's important and what you should and shouldn't, be caring about, I suppose, is something we want to try and help. So we'll be reviewing those, reviewing what's coming up, prioritizing what we think is important for this space, and doing a bit of commentary and analysis, hopefully on the days they come out. I think the labour market stats will be a key thing for us, particularly the quarterly annual population survey stats, because they're a much better sample for Scotland. And we're able to drill down into a bit more. But also I think things like inflation and utilising and bringing out some of the new analysis ONS do, looking at how inflation affects different groups of the population, so bringing some of this really great evidence to the fore and combining it with some insights from other evidence, including the qualitative literature, to actually say, well, why is this important for health inequalities? What does it mean? We will definitely take the opportunity to delve into the new data coming out of the census. And from what we understand, that there will be from May, which is now May, so anytime now, there will be a series of sort of new reports and new data coming out from NRS on different elements of topic analysis, they're calling it, from the census. So it's still not the raw data, it's still not a lot of data to play with, but on particular themes, they're going to be bringing out new data. So we'll be looking at those and seeing where we can add value to those and bring some evidence together. And obviously, as we get into the unit, we're going to be here for a few years. So as more census data comes out, there'll be more opportunities to make the most of that. The fourth thing on here is proactive analysis. So obviously that's quite a vague term, but that's where we will be doing kind of small sort of our own topic-based analysis on things that we think are really important, things that we have expertise in, things that we think we can add a bit of value to. So clearly there's a lot of talk at the moment about economic inactivity in the labour market. We feel we could probably do something that kind of delves into that a bit more. Some of the stuff we often do at the Fraser is just a bit of a deep dive into something to sort of help get it the information a bit more accessible, translate some of the technical terms and kind of say, what does it mean for policy, that type of thing. On a similar theme, when we have number 5 here is translating UK analysis to Scotland. So, every other day it seems the Resolution Foundation or the IFS has got a report out saying about this and that about the UK. And it's great, but when you're in Scotland, you want to know, well, is it the same for Scotland? Have they looked at Scotland? Is it different? So we're really hoping we can spend a bit of time actually when those reports come out, pulling out the Scotland specific information out of them, maybe making it clear that the analysis says it's UK, but actually they only did England and Wales. If we can try and replicate some of the analysis to look at whether the trends are the same in Scotland. So again, adding value to some really great resources that are put out by UK-based organisations. And I mean, actually, the Health Foundation might be others in our sites in terms of some of their analysis they put out that's UK-wide, but can often be very heavily dominated by the England and Wales data and research that they've done. So we hope that will be helpful. It's certainly something I always want to know when I see a report coming out from an organisation down south. And then the last one is a bit more in the kind of thinking about some of the stakeholders, particularly in public bodies who don't have access to academic papers. So we're lucky here that we do because we're in a university. But there's clearly, I mean, used to be a civil servant, and I wanted to know what the evidence was, what the most recent studies that look at some of the, evaluations, causal analysis, and I couldn't get my hands on them. And even if I could, some of it was way above my head in terms of, I'm an economist, but econometric analysis is, yeah, still takes a long time for me to work through. So we're going to try and do a bit of a translation piece with some of those, maybe looking again back at the archive a bit to see what some really influential studies have been, trying to draw out what you can and can't take from them, what's causal, what's descriptive, what does this mean, and provide a bit of a kind of a bank of that kind of information. You know, and people can volunteer their own ideas in terms of things we should look at, and translate for a non, well, like a lay audience, I suppose, normal people, not just academics can understand. So that's where we're at with competency analysis. There'll be time later if you want to feed in any more thoughts. It's quite exciting. I'm really excited about this part of the work, actually. I think it will be actually quite fun as well as hopefully really informative, and will help get our kind of people to know who we are. I'll talk briefly here about data improvement. So we do have David Jack, as Kat said, is working on this, but since we created the slides and about 2 months ago, and since then David's been off on paternity leave, so he's not come back, and he's not full-time with us either at the moment. So there's a lot to do in this space, and I think over the summer we've got work to do in scoping of data gaps and to start that process of prioritizing what we do in this space. There is so much data out there. There is many organizations producing really good data. So we're not, and there are a lot of organizations already thinking really carefully about things like data linkage. So we're not, you know, we're not going to duplicate that already very good work. But what we are going to try and do is help make it more usable, maybe for some of the so when you've got a lot of health data, how can we make that more usable for people whose most of their work is in the socioeconomic sphere? Where we've got socioeconomic data, how can we make that more usable for people who are just in that public health or health policy sphere? It's kind of, you know, trying to do some of that translation and building that bridge in between. Kat's already talked about the need, the desperate need really to do a lot better on integrating qual and quant evidence together rather than them being two separate things, sometimes saying different things and without actually understanding why that is. And they need equal billing. It's one we know quant analysis tends to be the thing that's picked up and used more routinely, but it's without the qual insights, it's not actually you know, it can be more unhelpful than it can be helpful. So you need that context, and you need to understand what's going on under the quant, and the qual can really help with that. At the same time, when you've got really good qual data, actually having a bit of quant that comes underneath to underpin it can really help with its robustness and its accessibility to a range of audiences. There are three themes I've got here. I won't go through the detail, but they're three really important things. So the intersecting inequalities element is something we really want to try and focus on. At the moment, we do a lot of analysis on health inequalities by SIMD and by geography, because that's not because it's easy, it's obviously really informative as well, but there's a lot of people that can do that type of analysis. What's much harder to do is to link health inequalities to things like households and individuals and different types of household groups and different characteristics. That's much harder to do. The data sets are not well set up for that, but there is progress that can be made there. So we want to try and prioritize and think, so what would make the most difference there? We might and try and work with other organisations, particularly Public Health Scotland, RDS, Scottish Government, to see what's, you know, where things are coming through as priorities, what can be done. Also involves UK Government, DWP, HMRC in that. And yeah, they're very hard to deal with, but it's not impossible. So we're going to, you know, aim big and then see where we end up with some of these things. We also think like just taking things, turning them on their head a bit can be a really good way of starting out with looking at things. So we've been exploring some of our other work in the Fraser, our work on people with learning disabilities, the role of people owning their own data and being the central point for data. It's never going to be, rather than trying to link data above people, actually starting with the person and that person having access themselves to the data and determining who else can access it. So that helps with the trust and consent bit as well. But it's a different way of coming at these things. I think survey data is maybe not going to, well, we know it's already having problems. Labour force survey is already having a lot of problems with getting people to reply. Admin data is great, but there's so many things you need to think about in terms of consent and privacy. So there are maybe other ways we need to start thinking about these things. The improving visibility, I think I've talked about a bit already in terms of helping people in different spheres, different organizations, be able to access and use data in a way that they can do. So if they're not, they might not be an analyst, they might not have analytical support anywhere near them, but they still, you know, want to be able to use data. So we're going to think about that, and a lot of this will be just using what's already exists and using the resource we have to try and make that visible and accessible. Again, we've done quite a lot of work on this in the learning disabilities world to try and just help people understand where there is and isn't data that can help on this area. And the last section, which is really important, on the trust and consent, we have to really think about this really carefully, particularly if we're doing any linkage into health, because it's, you know, it's personal, private data. So we need to think really carefully if anything we're doing, that needs to be front and center in all that we're thinking about. Over to Kat.
Great. So I'm going to talk a bit, about what we're thinking of in the implementation gap work, and we are really interested in your views on this because we're at the point of making some key decisions about which policy areas we'll focus on. So as Chris mentioned, when the people were asked, like stakeholders in around Scotland were asked about tackling health inequalities, there was kind of a strong consensus that there is good intention in government policy, but it's not making enough of a difference on the ground. Also, Ellen and I did a small bit of work where we tried to review all of the qualitative evidence we could find that's already been published, that's where people in communities in Scotland, mainly disadvantaged communities, were asked what impacts on their health and well-being. And they spoke a lot about social and economic determinants of health, kind of really underlining the fact that people do understand the fact that housing and employment are impacting on their health. But what also came through strongly in those accounts was their experiences of implementation and how different that can be from the kind of policy formulation side. And a lot of policy analysis and efforts to influence policy focus at that kind of top government level. What you get in the qualitative data is a sense of how important it is to understand all of the different actors, different levels that are involved in implementing that. So that's what we want to do in this work. So there'll be different strands of research that inform this work. So there's going to be a kind of policy top-down tracing where we take two policy areas and we try and look at the formulation side of things. What were the government trying to achieve with that policy, and then we kind of trace that down. I'll talk about that in a bit more detail. We also want to do some work starting with communities and asking people about their experiences, and then the solutions that they would like to see, the changes that they would like to see. So we're kind of thinking of that in a bottom-up way. Some of that research will involve peer research, and that's some of the work that we will be procuring over summer. And then we also want to do some action research with people who are kind of at that middle level of are often charged with implementing policy and so organisations and people that can make a difference but often haven't been the focus of a lot of policy analysis. And we'll also be procuring some work in that space too. So I'm just going to say a little bit more about this top-down, bottom-up work, because this is the area where we need to make decisions on which policy areas we focus on. So the idea is that we'll simultaneously take two policy areas, one after the other. We'll simultaneously be doing this kind of top-down tracing, thinking about, okay, so when the policies were formulated, what was the goal here? What was the thinking? What was the assumption about if we make this change, how will that play out? Then looking at how that's been interpreted and implemented, then operationalized. Sometimes that's the same people, sometimes that's kind of a level below. And then also looking at community experiences of that issue and trying to understand how those community experiences link to the policy. At the same time, we'll be doing this community grounded research involving some peer researchers in key communities that we're focusing on. So we've got a particular focus, which comes out of the first stage review work, on young men and on children with families with young children living in poverty. So those are our two kind of key population groups. So the proposed methodology for this top-down work, I'm not going to go into lots of detail, but a lot of evaluations tend to focus on a change happening, so a policy or an intervention, and then looking at the outcomes, like did it work, that kind of evaluation. This kind of process tracing method is much more about the black box in between. So what actually happened at each stage of that, and why did it happen? We will look to other people's evaluations that are kind of looking at whether whether key outcomes did change or not, but our focus is on understanding the process, like what changed at each level. So it'll involve, like, right at the beginning, kind of starting with some of the people that were involved in developing that policy, trying to understand how why they made the change they did, how they were thinking about the problem, so how they framed that problem, and then how that led them deciding that this would be the most appropriate policy change, and how they thought, what they think the causal kind of implications of that. So what changes do they think will flow from that, and why do they think that will make a difference in terms of outcomes? And then we're going to kind of try and clarify those kind of perceived causal pathways, and then, like I say, trace down at each different level who's charged with kind of interpreting that policy and operationalizing it, and then what are community experiences. And we're going to try and bring those insights at each of those different levels together to try and kind of understand across the piece what's happening in this implementation process. So it's a very deep dive, kind of qualitative approach to understanding what's happening in a small focused number of policy areas. So it's quite different to the kind of analysing data, which would be big picture across a number of different areas. This is like a focused approach, which will tell us hopefully a lot about a small number of areas. And then the bottom-up community perspectives, because we think it's really important not just to start with a policy approach and trace down, and then to only ask people in communities, what do you think about these policies, these specific policy interventions? We also want to do work where we're working with communities in a much more open way, working with organisations so that's part of the procurement process. So we don't feel that we're necessarily the best placed people to do that work. We'll be working with organisations that already work with communities. So, and we want that process to start in a really open way. So asking people, what are the key things that are impacting on your health and well-being? But we will then ask some kind of guiding questions towards the key policy areas that we focus on, which I'll say a little bit more about in a moment. But we want to at least allow for the possibility that people will say, actually, those are not the most important things impacting on my life, and you want to be considering something else. We really want that work too to have a kind of solutions orientation. So not just to be asking people about what the kind of negative things in their life and what's impacting them negatively, but to be having conversations about jointly developing solutions, the changes that people would like to see. This slide here comes from a different project that I've been involved in, which Ellen is also involved in, and Ali, who's here, quite a few people in the audience. So it's called the CIPHER Consortium, and it's using systems science to look at socio and economic determinants of health. One of the methods that we've used in CIPHER has been systems mapping. This systems map that I've got up here is showing how reviews of evidence suggest housing impacts on health. And that's the grey links come from those evidence reviews. But then the red links come from asking community panels about their perspective of what's impacting on their health. And so what's really important there is that when we spoke to community panels, and Ellen was leading that work, they came up with some kind of things that were not being captured through that evidence review process. And so partly this speaks to the importance of bringing together those different types of evidence. But I also wanted to show it because this trying to think of things in a systems way, I think, can be quite useful in unpacking how people think a policy might actually lead to change. So we might use some systems mapping when we're kind of asking policymakers and people at the different levels, like, how did you think this policy change would impact, and how did it actually impact? We might use some systems mapping to try and draw that out, so we get a bit beyond the kind of very linear, well, we did this and then we thought this might happen. I'll pass back to Emma to say a bit more about the clear research.
Yeah, so just to focus on this a little bit, because some of you here might be interested in working with us on these bits. So, and some of you might have never heard of research and action learning. So we're just going to do a little bit on these. So we are really clear, I mean, in all our research, and the Health Foundation are also quite clear on this, that having participatory and community approaches is so important in order to build evidence on this. But it's something you have to come at really carefully because it's quite extractive. There are a lot of power imbalances in this type of research, and the type of people who you want to get the insights and learn from are those that might not be those that really want to speak to a researcher from the University of Strathclyde. So we are trying to think and use knowledge of different ways of working through these issues by recruiting people who live in those communities and providing them with quite, good but basic researcher training, which enables them to then be the researcher. And it means that you are obviously, hopefully, able to get past the access barriers a little bit more. Of course, there are still power imbalances at play there. Of course, it's still going to, be problematic, but particularly with the communities we want to speak to. So the kind of younger adults, men, so late adolescents into their sort of early 20s, they're people that we're really going to have to try very hard to reach. So we think this is an approach that could work. Well, fostering that sense of trust and understanding amongst people who are facing the same situations. And it does feel a little less extractive than some of the other ways of doing participatory research, because people are paid to be researchers, they get training, they get support, and it can be quite a good experience for those individuals. Well, hopefully it will be, as well as really kind of boosting the research forward. It needs to be done really carefully, and there needs to be an organisation involved in this who is able to support those people well. So that is why we know that it's something that we need to work with a partner on. It could be 2 different partners for the 2 different key groups we want to work with. So the younger adult men and the families with young children. So it could be 2 partners, or it could be the same. We're open to that. The next part is the action research. So I've got a quote here: if you want to truly understand something, try to change it. And I think it's a really good way of thinking about doing research, particularly with experts, but people in that kind of policy and practitioner space who are, this is their job, this is their life. But they don't always get that chance to take a step back, and nor do they always get the chance to learn from their peers. So this is partly comes from experience of working on projects where we've used action research, and it's also partly from my experience of working in government, where I was recognized very much that there was a multi-layer policy making and delivery and operational aspect to the work I was involved in, but I had no idea who any of these people were other than those in my immediate, layers. So what we're wanting to do is to facilitate that kind of peer research process. So a lot of it, in a way, for the organizations and the people involved, is a bit of a sort of a learning and training and development type activity, because you are actually taking that step back and reflecting and hoping to work with different people to solve issues that are coming through in your day-to-day working life. And the idea is that your peers in that group will be able to identify with some of what you're talking about in terms of some of those issues. They could be quite minor ones, or they could be quite major ones, and help to think of options that an individual in an organization with a limited amount of agency, but with agency nonetheless, can make a change that might sort of unblock some of the issues with implementation. So that's the idea. So we want to bring this in as a component of our work. We just feel it's a very good way of engaging with policy and practitioners as well. But it's also got a huge, from a research perspective, the insights that you get as a researcher from observing those sessions is massive. Things you would never know to ask about in an interview if you were doing that type of research. You get these kind of different perspectives and these real solutions and real barriers that you would otherwise, as I say, not even know to ask about. It's all anonymous, it's all kind of privacy is respected. But there is a research output that could come out of it that looks at where there have been breakthroughs and solutions that the groups have managed to achieve, but also is able to point to where things were totally out with the group's capacity, and it's a more system-wide change that needs to happen. So that's, we want to give this a go. It's a bit experimental, but we think it's something that could really add a lot of value. And it's people, again, we will need to procure a partner to work on this. There are particular consultancies and organisations that do have really good experience of this.
Okay, so then I wanted to say a bit about the aspect where we particularly really welcome your views. So with this implementation gap work, it's in depth, and we can only focus on 2 policy areas maximum, I think, initially. So we have been thinking about which of those policy areas that we should focus on. There's a very long list here that comes up, like partly this comes from the stage 1 review, but the broader evidence base and conversations with stakeholders as well. So I won't go through them all in detail. We've been considering all of these, and then we started developing criteria, working collectively with the Health Foundation as to what should guide the choices. So these are the kind of things that we've been thinking about. So do we think this this is a social determinant of health that's really important for health inequalities in Scotland? Is it researchable? So from an implementation gap point of view, is there a feasible policy goal, strategy, set of policies that where we can study the implementation? Is it actionable? So there are good grounds for thinking that policy changes could improve or prevent that issue. So this work, could it make a difference? Is it a cross-sectoral issue? So is it that something that's linking a kind of social or economic policy area to health? Is it politically relevant? So is there a political appetite? And we don't just mean in terms of political parties and manifestos, but that broader kind of policy influencing network. Would there be interest in this issue? And then, so that was our initial list. And then as we've been reviewing them, we've added some more. So the ones in grey are kind of more recent additions. So we have been thinking, like, are there reasons to think that implementation might be particularly problematic for this issue? There are some policy areas where we considered, and they were kind of yes for all of the first ones, but actually we didn't think that implementation was the key. Are they relevant to our target population groups? So that's young to middle-aged men and parents of children in poverty. And are they under research? So are we confident that we'd be addressing a research gap, or is there already research going on in this area? Because we definitely want to add and not in a useful way and not overlap with what's already being done. So like applying all of that to our long list, we have ended up with our front runners being housing and homelessness and employability. So on housing, there's a couple of areas that we're thinking of. So one is housing quality and policy efforts to improve current housing. That's a slightly more complex policy space where there's different policy factors. So kind of things like the environmental agenda impacts that, as well as housing and health and so on. And there's a kind of suite of policies in that space. But there's a clear policy team, and it's an issue that affects a lot of people, so potentially could make a big difference. Or the other area that I've been thinking about in relation to housing is the duty to inquire to prevent homelessness in Scotland, which is coming into place very soon, and there's a lot of consultation going on around it at the moment. And this kind of is one of the areas where Scotland would be taking a slightly more radical approach than the rest of the UK in trying to prevent homelessness. It's a really great idea, but we're already hearing quite a lot of concerns about the resources accompanying that, and the sense that actually the kind of ambitions aren't being matched by the resources needed to make that change happen in a really effective way. So that's a very specific policy. It affects a smaller number of people, but still in really important ways. And we can already see that there is an implementation gap there. So we're considering those two areas in relation to housing. In relation to employability, we'd be looking at the No One Left Behind policy, which is, there's kind of 32 versions of that across Scotland in the different local authorities. So that's complicated in a slightly different way. And we'd need to think very carefully about how we sample that, like, because all the local authorities are approaching this in quite different ways, as well as having quite different contexts to deal with. So yeah, we still have some decisions to make around those two issues, and we're also interested if anyone feels very strongly that we shouldn't have rejected the list that we've rejected. So we've kind of put our reasons in brackets as to why we think we're not going to focus on those other issues, but really keen to hear your views on that.
Yeah. So just a couple more things. You'd be glad we've been talking for about an hour. So just some people in the room might be interested in this, are timelines and procurement for the peer research element and the action research elements. So we have a big budget for this. We have, well, this probably won't go as far as we'd like it to, but 275,000 over the course of the project to procure partners. So we have two elements to this, as we've mentioned. So the peer research. So not only will that feed into the implementation gap work, and not only into those, whatever the two areas we choose are, there's also that the work that they and the, well, what that research brings up will probably be much broader and will probably inform different aspects of the program and be used, you know, throughout the 2.5 years. Based on some advice from organizations that do this type of thing, it was kind of felt that if we're going to do this, the setup costs for peer researchers, the training involved, means that actually that's probably takes about, you know, 4 to 6 months. So it's better if we, you know, get that all set up and run it for the whole length of the program, basically. So we think that's what we will do, but we will need to have some flex, because it is a bit of an experimental approach, some of this. So we'll need some flex maybe in terms of what questions we're asking, or you know, prompting after, you know, the first year or so. But it's very much something that will be set up to support the program the whole way through. And the action research is probably in the first instance going to be for a shorter period of time. So we have chance to review roughly halfway through the program as to whether it's working in the way we hoped it would, or whether we need to pivot and do something slightly different. So we are going to procure for 1 year of field work with a dissemination phase that follows that. And during that dissemination phase, we will be doing the or maybe a bit before, we'll be doing the review with the idea to procure out for the second half, or bit of the program. Could be an extension, or it could be it might have to be something a bit different. So that's where we are with that, and we need to get a move on, basically. It will all be done through Public Contract Scotland because of the size of it, but it will be hopefully, we're hoping by the end of May we'll be at the point where we're nearly ready to push the button, if not ready to push the button. So, and we think we'll be able to give it at least 2 months for bids to come in, with a hope that towards the end of the summer, sort of September time, we're kind of ready to go. There's some complications in this, and if anyone's got expertise in doing these types of works, particularly working with universities, it would be great to chat, because we have things like ethical considerations, and we've had lots of experiences with our ethics boards here, and it can take time. So we need to just get all that in place before we start. So that's where we're going with that. Really, finally, and this is the final thing before we actually do the engagement, but to talk about the importance of engagement. So we've been already started on our stakeholder mapping of our known knowns, particularly, and a lot of you in the room today are sort of known unknowns. Like we know of you and we really want to work with you, but we might not have had the chance to do that before. There are some known unknowns here too, don't worry. But there are lots of unknown unknowns of people that we should be talking to, but we don't know who they are, and all those kinds of things. So we're doing that process, and it will take time. We're working with is a comms organisation that are supporting Chris and the Health Foundation for some of their messaging, and they're helping us a bit, some of the things we're not as aware of in the sort of political sphere in terms of stakeholders there. We will be spending some time over the summer going and speaking to people face to face that we want to take that time over, whilst we're still in this kind of design and planning phase, to kind of really hear those voices and see where we go with what we hear. Our next big public session will be in September. where we will probably be doing a bit of a launch, this is a soft launch, that will be a proper launch. I don't know, it will have balloons or something, I don't know. What's that? It'll have a name. So that'll be an improvement. But during the program as a whole, we do want to be doing quite a lot of public facing events, webinars, and hopefully we're going to hold ourselves to doing regular podcasts that just sort of explore different elements of the project. And then we, as we were doing this morning, we were at a public health event. We need to get out there and meeting people and going to other people's events and supporting in any way we can with other people's work, and just we've got our time is partly to do that as well. So that, and the networking part is what we're sort of here for partly today as well. Yes, as I said, we've got some time, got plenty of time for questions and for comments, and then hopefully you can stay for a bit outside for some tea and cake. I hope I've said this cake a few times now. I really hope this cake. But yeah, so we have got a bit of time now for questions of me, myself, Chris and Kat. We've got some questions that you might want to think about and comment on.